Hello, and welcome back to the next episode of This Healthy Life podcast. Today I have with me Dr. Myriah Hinchey, who is a naturopathic doctor and medical director at Tao, specializing in Lyme disease and chronic inflammatory conditions. She has over 17 years of experience and is also the founder of Lyme Core Botanicals, which is herbal solutions to vector-borne diseases. And in addition to her medical practice, she also leads the Lyme Bite Symposium and the Doctors Talk Lyme Summit. Welcome, Dr. Myriah Hinchey. I'm so excited to have you here today as a guest and share your wealth of information and everything you're putting out in the world. So welcome.
Thank you, Erica. Thanks so much for having me. I'm excited to be here.
Absolutely. So let's kind of get started with a quick intro about yourself. I want to hear how you got into naturopathic medicine and also specializing particularly in Lyme disease. And if you can give a little background on what your practice is like and how you started that.
Sure. So it's a bit of a long story how I came to be interested in naturopathic medicine. I actually didn't even know what a naturopathic doctor was until I decided that's what I wanted to do. So originally I was going to be a physical therapist. And I started working in a physical therapy office in my first year, actually, at the University of Connecticut, because you looked better on the application into the physical therapy school if you had some experience. So I started out as a receptionist and then a PT aide, and they had a lot of massage therapists there. And so as a PT aide, I was working with some of the massage therapists to learn some of the massage techniques and really kind of fell in love with massage therapy. So I decided to take 2 years off from UConn and go to school and get my massage license so that I figured it would just make me a better PT and I could make some money while I was going to school because I needed to work while I was in school. And then while I was in massage therapy school, you know, we learn Eastern medicine and you learn about prevention and you learn about underlying cause and treating the whole body. So I really fell in love with that philosophy and learned a lot about herbal medicine, et cetera. And so also a lot about the mind-body connection. And so I went back to UConn and decided I didn't want to do physical therapy anymore. I wanted to do psychology. And my plan was to actually develop some sort of psychotherapy while you had your hands on the patient. And so I was back doing psychology at UConn, and I was doing massage therapy at a day spa down the road. And this woman came in and told me she was all stressed out because she had finals coming up. And it was like, oh, what do you go to school for? And she said, a naturopathic doctor. And, you know, I was like, what is that? I had never heard of it. And she said, well, you know, you're a doctor, but you use natural medicine, you figure out the underlying cause, and you use acupuncture and botanical medicine and therapy and all of these different things. And I was just like, oh my gosh, like I literally from the moment she told me was like, I am going to be a naturopathic doctor. And
that's awesome. That's what you became.
Yeah.
Awesome. So how did you decide to go into the route of focusing on Lyme disease and chronic conditions versus kind of just general naturopathic health?
Yeah. So, I mean, I started out just doing general family medicine. You know, there are some naturopathic medicine or some naturopathic doctors that simply use natural means to treat symptoms. The way that I was trained is really looking for the root cause or the underlying cause of the patient's symptom and addressing, you know, your treatment, whatever it may be there. So living in Connecticut, you know, ground zero for Lyme disease and living in rural Connecticut, I had to know and understand very deeply about tick-borne diseses and what they do to the body, because I was finding often that it was the underlying cause or the root cause of a lot of these patients' issues.
Yep, absolutely. And so you've been treating Lyme disease basically for 17 years, essentially. So you've seen it kind of really progress in different ways and new treatments available. Can you share a little bit about what your approach is for working with Lyme disease and what you have found to be one of the more successful treatment routes for it?
Sure. So, so I've been treating Lyme disease for 17 years, which is just about as long as I've been out of school. So I was fortunate enough to have a patient come to me in clinic who had chronic Lyme disease and Babesia, and she had been on IV antibiotics for about 6 months and still was very, very sick. And she was in her 20s. And, So again, I say I was fortunate because, it's not like naturopathic doctors are taught differently about Lyme disease than a conventional doctor or any other medical professional for that matter. We were taught, I remember the little case study, like on the exam was like, oh, these little kids were playing in tall grass. And then all of a sudden, a week later, there was a EM rash that looked like a bullseye and they had achy joints. And oh, they took, a couple weeks of doxycycline and bam, they were all better. Like,
Yep.
had I not had that woman in clinic, I would not have known anything different. We treated her with hyperthermia baths and Chinese herbal medicine. And I only got to work with her for 9 months before I graduated, but she said that she felt more relief in that period of time, than she had previous to coming in. And I wish that I would see or hear from her again. I lost track of her. I have no idea what happened with her. But I then out of school, at least knew that Lyme was not what we are all taught. So I had that going for me, I guess, so to speak. I very shortly after school joined the International Lyme and Associated Diseases Society, or ILADS, which I consider to be like the first and foremost top authority on treating vector-borne disease and complex chronic inflammatory conditions. So I learned a lot there. And I've been going there, ever since, every year to their annual conferences, and I frequently lecture at them now. But, I've run the gamut from knowing how to accurately diagnose and then quickly shipping them off to a Lyme literate doctor that did the appropriate, combination prescription antibiotic therapy, while I just tried to protect their gut and kind of hold down the fort, as best I could, worked on boosting the immune system and all of the other sort of ancillary work. Then a few years in, after learning what I learned with my own body when I had all of these infections, I started doing integrative treatment. So I was, having a Lyme literate MD manage all of the pharmaceutical antibiotics and antiparasitics and antifungals. And then we were using the herbal protocols. And, I use that term protocol very, very loosely because I do extremely individualized medicine. But, doing like an herbal regime and a lifestyle, approach and all of that simultaneously. And then, very long story short, I had two self-selected groups of people who were doing integrative, and then the other group who was just doing herbs and lifestyle. And over a course of about 2 years, myself and the other two doctors that were working in my practice realized that patients were more quickly resolving their, quote unquote, Lyme disease and weaning off the herbs without relapsing. Whereas I had patients who were in that integrative boat, let's say, who were rounding year 4, year 5, and still not 100%
Still better.
And still, right, like not to the point where they could stop taking something. And then, let's say over the course of a couple years, a few of those patients would get either, like C. diff, or they would get gastritis, or their liver enzymes would go up, or something would happen where they would stop taking the antibiotics. And now they would almost transfer over into that herbal lifestyle medicine only group. But then, oh my gosh, their plateau stopped and started to get better and better and better. So it took about 2 to 3 years before my eyes were opened, I guess, so to speak. And as a practice, the 3 doctors, we were like, look, if this is working, like, why are we using this long-term triple antibiotic therapy piece in a chronic situation, right? Where someone's already had the appropriate amount of antibiotics plus some. And so we decided at that point that as long as patients were progressing in the rate that they should, and they wanted to do this herbal lifestyle medicine, functional medicine, natural medicine approach, that's what we would do. And so that was around 2016, 2017, so it's been 5, almost 7 years
8 years. Yeah.
yeah, where that, I know, I forget what year. Where,
It's been a lot longer than 5 years.
right?
It's a time warp sometimes, right?
Ever since COVID. Yeah, it seems like.
That's great. So currently in your practice, are you still having some patients use antibiotics? Or are you going purely the kind of like herbal lifestyle, more holistic route?
So it's up to the patient.
Mm-hmm.
Really up to the patient. So, and it depends. Am I the person that diagnosed it, or are they coming to me after seeing, 1 or 6 other doctors and still not able to get better? I think the light bulb moment for me was when I realized that in the end, it's the immune system that has to either completely eradicate the infections or force them into remission and stop them from replicating. There's no amount of antibiotics, prescription or herbal. Like, this isn't like herbs, versus pharmaceuticals. This is like, if we don't fix the immune system, you will never be able to stop taking the antimicrobials, because as soon as you do, the infection is just going to grow back in all of the little places that it's hiding.
Exactly.
So when you're taking things that are destroying your microbiome, and you have a majority of the immune system in the gut reliant on that microbiome, you can't fix the immune system. And so when I had this realization, it was back when all of this research was coming out about the microbiome and how important it was and how important it is in immune function and inflammation, right? And so those are the two biggest things, the two biggest mechanisms in which Lyme stays in the body is immune dysfunction and an extreme inflammatory cytokine cascade. So I was like, okay, this makes sense. This is why once patients stop with the pharmaceutical antibiotics and move over, and we're working on healing the gut and rebuilding the gut and dealing with that inflammation and fixing the microbiome and the leaky tight junctions and all of that, then all of a sudden it's like their immune status is improving, and we're using the antimicrobial herbs that are much more gentle on the microbiome.
On the gut and the immune system in general. Yeah. And I'm glad you brought up the kind of cytokine storm inflammatory cascade that happens, especially with Lyme and mold. What are things that you use in your practice to kind of control that inflammation or try to bring that down while you're working on the immune system?
So as far as Lyme and most of the other vector-borne diseases, all of the inflammatory cytokines, so whether we're talking about nuclear factor kappa beta, MMP9s, the MAPKs, interleukin 6, interleukin 1 beta, tumor necrosis factor alpha, like all of those guys, if you take a combination of Japanese knotweed and Chinese skullcap and cordyceps, it actually inhibits all of those inflammatory cytokines.
That's amazing.
And the great thing about herbs, because there are a lot of drugs that will shut down, for example, like interleukin 6, right? So high interleukin 6 drives the T helper 17 path, which can lead to autoimmunity, right? So a lot of the autoimmune drugs are going to shut down that interleukin 6 to stop the Th17. But see, with pharmaceuticals, they're kind of like all or nothing, right? Like they just shut it down, they block it. And with a lot of these herbs, if they're adaptogenic, it means they balance. So it's like they're not going to turn something totally off. They're going to help.
Just going to get it to work correctly.
Right, into balance.
And then is this something that patients have to take for the rest of their lives, or just while they're kind of getting their immune system a little healthier to be able to manage it on their own eventually?
So it depends on the person. It depends on how long they've been sick. It depends on how much damage has been done. And it depends on how compliant they want to be. Yeah. So I would say a majority of my patients go through their treatment, which honestly is anywhere between like 1 and 3 years, depending on how long they've been sick for. And, newsflash, if you're doing triple antibiotic therapy, it's, it can be as long or longer, so the treatment is lengthy, but in the end, almost all of the patients get weaned off the antimicrobials and most of the herbs for that matter. I have a
Mhm.
handful of patients who choose to stay on a combination of Japanese knotweed and cat's claw
Mhm.
because it's almost like their security blanket.
Yeah.
And they
Those are
both
great herbs. I took a lot of those in
they
my
are.
recovery as well.
They have antioxidant, anti-inflammatory, anti-tumor properties. I mean, the wonderful thing about herbs is all of the side benefits that they have. Especially if you're taking them in a whole preparation. So I don't mean you have to take the whole herb like flower to stem and root, but like with Japanese knotweed, a lot of people, and this is kind of like that conventional medicine thinking, it's like, okay, there's resveratrol and resveratrol does X, Y, and Z. It's like, yeah, but there's also 7 other bioactive medicinal compounds in Japanese knotweed that does in just the root, that does a whole host of other things. So it's like, yes, the root with Japanese knotweed is the most important part of the plant, but let's use the whole root so that we get all of those constituents and we get all of the desired effects that work synergistically instead of just extracting resveratrol. Does that make sense?
Absolutely. Yeah. There's so many different components in it and can kind of have all of it or pick and choose the pieces of it that you need, which is
Yeah.
great. Awesome. Well, I'm really glad you touched on, I think a big piece in Lyme really is about recovering your immune system because I was blown away. I read somewhere that doxycycline doesn't actually even kill Lyme. It just slows this replication cycle so that your immune system can actually kill it. So it's just like when I read that, I was like, you need your immune system to kill Lyme and keep it in check once you, get that down. And I never personally did antibiotics in my Lyme journey. I decided to go kind of like the more naturopathic, holistic, herbal route and kind of really just cleaning out my body, a lot of detox and really cleaning up my immune system. And I've been in remission, like 6 years now, 7 years now. So I'm still doing well, knock on wood. But obviously I still do a lot of things in my daily life to make sure I stay healthy and maintain that health. It's not like you're like, oh, I'm better. I can go back to eating whatever I want or doing all the things, but it's really about keeping that immune system healthy and just making yourself more resilient in the world, no matter what's going to kind of come at you. So
Right.
I love
Yeah.
that.
And I guess I should be complete with my answer to your question. So, yes, most people get off the herbs, but they typically have to stay on a handful of like supportive nutrients. So,
Yeah.
like, depending on where you live, vitamin D, EPA, DHA,
Yeah.
an activated B complex, vitamins, minerals, maybe some like phosphatidylcholine or serine. Like, again, it depends on the person. And then, most people do end up needing to remain gluten-free, dairy-free. Those are my 2 biggies, right? And eating a healthy diet and trying to manage their stress.
Yeah.
So, yeah, if you just go back.
All things that everyone should do, whether you have Lyme or not, right? Awesome. Well, I want to shift gears a little bit. So you mentioned you're in Connecticut, obviously one of the hot spots in the country, but there's plenty of others, including the Midwest, even California. I think I saw a stat recently that it's number 4, the number 4 worst state for Lyme. That's where I got it. I know several people here. So right now we don't have any accurate testing. We don't really have an accurate way to know if you got bit. Sometimes you get the rash, sometimes you don't. So what are some things that people can do kind of in their daily lives to make sure that they're preventing Lyme or becoming more aware of it if they do want to enjoy the outdoors, just so that they can catch it sooner instead of it progressing to a chronic case?
Right. Well, so first, let's be clear. So there's Lyme in all 50 states in our country, and there's Lyme all over the world. So
absolutely. I think everywhere except Antarctica.
Yeah. So just want to make sure we put that out there.
Yes, absolutely.
I think probably one of the most important things is doing tick checks on yourself and on your children and on your pets. If you can get them while they're crawling before they've attached themselves, then you're right there, basically eliminating the possibility that you're going to contract Lyme. You can't get it while they're crawling on you. So doing tick checks immediately as soon as you're coming back in from doing any sort of like risky behavior, I'll call it. You also can send your clothes out, like if you're a hunter or you like to fish or you're a hiker or a gardener. So you can send your clothes out to Insect Shield and they will dip them for you, or you can buy socks that have been treated. Cutting back trees and shrubs and making sure that your lawn is mowed as short as it can stand for your weather and that leaves are raked. Ticks cannot live in direct sunlight when it's very, very hot. They like moist, shaded areas.
Mm-hmm.
I always tell parents, don't put your swing set in the shade. Like it's the perfect tick haven, right? Um, the simple things that I think everybody hears about, cover your hair, tuck your pants into your socks, wear long
Mm-hmm.
sleeves, things like that. I like using cedar oil and other various essential oils, to put on my body. If you're gonna go, in the woods and stuff, then you can do the treatment to the soles of your shoes with permethrin.
Mm-hmm.
Um, Trying to think what else. Oh,
I
tick
think,
tubes. Tick
and
tubes.
wearing light colors too, because you want to be able to see if anything's kind of
Right.
walking on you, right? Yeah. And
Yeah.
then
If
tick
I'm
tubes,
going in the
yeah.
woods, like this hair is not going to be out either.
You would never see it.
Never.
And especially when if they do unfortunately attach, they always like to feed in such strange areas. Like a lot of times
Yes.
it can be in the armpit or the groin or even in the scalp. And when you have dark hair, it's almost impossible to see them. They can be the size of a poppy seed. So I
Right.
always try to make sure people are like, I'm like, you're not going to see it. You may not even get the rash. Only 50%,
It's
I think, is
actually
the stat,
20 to
right? Is
40%
20 to 40% get the
I
rash.
found lately. Yes. And it's only with Borrelia. So like you're not going to get
Mm,
the rash with Ehrlichia,
yeah.
Anaplasma, Babesia. Bartonella has its own sort of rash that looks like
Hmm.
stretch marks. But yeah, so many doctors even are still reliant on the
On the
presence of an
rash.
EM rash. And again, it's less than 40%.
Hmm.
But if the rash is there, it is diagnostic no matter what the test says. So I think that's important. I've had patients who have flat out had an EM rash, and I've had doctors say, nope, that's cellulitis. Nope, that's a spider bite. Nope, that's
Awful.
something else
I
because
had
they're testing
a
negative.
strange rash. I thought it was just a spider bite. So hindsight's 2020, right? I had no idea what it was and never saw the tick that bit me, but definitely had a weird rash. I was like, oh, it's just a spider bite. I get bitten by bugs all the time, and I just kind of brushed it off, not knowing that my entire life was going to change with that tiny little bug bite, unfortunately. So if someone does get bit by a tick, what is your protocol? Do you rely on antibiotics right away? How long of a course of antibiotics should they take? Or is there herbals that they can take as well? Or what's kind of the best plan of attack if you do unfortunately get bit by a tick, and especially if you get a rash?
So I'll walk you through my whole ordeal.
Mm-hmm.
So if you find a tick, I would immediately FedEx it to tickreport.com.
Okay.
They, in my experience, have been the most reliable tick testing company. They are UMass Amherst is where they're located. They will get the results back to you within 48 to, I think it's a max of 72 hours. I have
Oh, wow.
sent numerous ticks to them, and I've pretty much gotten almost all of them but one that FedEx lost.
Mm-hmm.
They got me the results within 48 hours.
That's
And that's
great.
important because you have about a 4-hour window for doxycycline to prevent the infection. There was a flawed study that was done several years ago that references taking a dose of doxycycline at the time of a tick bite and it preventing the development of Lyme disease. And that study is flawed for so many reasons. Number one, their diagnostic criteria for Lyme was the development of an EM rash within 30 days. So we just said an EM rash only shows up 20 to 40% of the time.
Yeah.
So how can you use that as your diagnostic criteria, right? So
Mm-hmm.
that alone is just completely flawed.
Mm-hmm.
It was also like a small number of people, and I won't belabor the point, but there's multiple reasons why that study is flawed. Yet there are so many medical practitioners that are still following that and giving these patients a false sense of security.
Yeah, I've heard so many stories of people being told that they were just given like one dose of doxy or 3 or 5 days, and then all of a sudden, 3 years later, they're sitting in the IV room with me with chronic Lyme, and it took them years to find out that that one tick bite wasn't treated properly, and that the 1 or 2 doses of doxycycline did nothing for them. So it's
Right.
really, really unfortunate that there's not more consistency in kind of the protocol for what to do with a new bite.
Right, it's true. And so for the record, it's 4 to 6 weeks. That is ILAD's standard,
Yep.
4 to 6 weeks to cover an acute infection, not a chronic, an acute. And that's because of the life cycle of the tick. So Lyme is slow growing and its life cycle is at least 21 days long. So 14 days isn't going to do anything. You generally need to be on at least 4 weeks. Now, going back to your question, what do I do? So I have them send it out and I have them start herbs immediately. Mm-hmm. So I have them go on a combination of Japanese knotweed, Chinese skullcap, and ashwagandha, because those 3 herbs will protect the endothelial cells of the blood vessels, which is how the organism gains entry into the body. It inhibits almost every single cytokine in the inflammatory cytokine cascade. And how this infection moves through the body is it stimulates enzyme production. Hyaluronidase breaks down hyaluronic acid. Collagenase breaks down collagen, and aggrecanase kind of loosens up the extracellular or the connective tissue so that the organisms can move throughout the body. So those 3 herbs together actually help to inhibit that process. Wow. So I use those 3 herbs. And then because we don't know what that tick had, maybe it wasn't just Lyme, right? Lyme's a bacteria. But what about Babesia? Babesia is a parasite. You have to use antiparasitics. And then what about the Powassan virus? That's a virus. So I put them on this broad spectrum antimicrobial combination of Petunia, cat's claw, and Cryptolepis would be like the least. So putting those 6 together, that would be my minimum treatment. And I would put them on that until they get the results of their tick test back. And then they can talk with their Lyme literate doctor about what the right next steps are. But I recommend highly, if they're going to go on a pharmaceutical antibiotic, that they remain on those herbs, because to your point, Doxy doesn't fully kill it. And antibiotics can encourage the persister cell formation. And herbs like Cryptolepis have actually been shown to be effective against the persister forms. So antibiotics are great. They save lives, but they're not always indicated and they're not always doing what we think they're doing.
It's easy for us to just rely on them, like, oh, I have a bacteria, let me just take an antibiotic and it'll kill it and be better. But that's not always the case, especially with tick-borne disease.
Right.
And then I'm glad you mentioned the co-infections too. Like you said, it's like you take the antibiotic, but that's not going to do anything for Babesia or viruses. And the Powassan virus is like a new tick-borne disease. I've been hearing about it maybe in the past 4 to 5 years or so. And, conventional medicine says that there's no treatment for it. It's can be even fatal. So I'd love to hear what your take is on that, if you've had patients with that, and what your protocol is for that, if they are able to recover from that.
So I have not had any patient with acute Powassan virus. And yes, it can be deadly. So there are various herbs that can be used. Petunia is good. Iastis is good. Olive leaf is good. Those are kind of my go-to 3. I might use monolaurin as an antiviral as well, but I would say and skullcap, Chinese skullcap, of course. So not only is Chinese skullcap anti-inflammatory and antioxidant and antibacterial, but it's also very strongly antiviral as well.
Awesome. And then, it sounds like you've been treating this for at least 17 years. You have your own personal story as well. So I always love hearing some of like the most amazing success stories you've had in your practice. So it's not all doom and gloom. What is 1 or 2 like amazing stories of recovery that you've seen in your practice with patients that you've worked with?
Oh my gosh. All right. Well, I'm just going to go with whatever pops into my head. Yeah. So I had, I had this young man. He was 17. He was in his senior year of high school at a high school in the town that my practice is at. And all of a sudden he started having panic attacks, severe anxiety, depression. Like they actually, they checked him into like an inpatient institution, because, he was like, quote unquote, having a psychotic break, so to speak. And so when he got out, his parents brought him to me to see if there was anything additional they could do herbally or lifestyle, because like the medications weren't helping him at all. And just to give a little bit of a background, like he was very good student. He was an athlete. He was extremely popular, and he literally, like, his grades were failing. He withdrew from sports. Like, he wasn't hanging out with his friends. Like, it was really bad. And, when I was sitting there during the first appointment, and, my agenda for the first appointment is absolutely nothing. I don't want to give you a treatment. I don't want to order a test on you. I want to sit there and listen to you and your family tell me your story so that I can pick up clues. Because if you listen to the patient tell you what is going on, they will tell you what is going on. Like, your answers are right there. So, all of a sudden we're talking about, like, he's having insomnia, and he's having drenching night sweats, and he's having, like, all of these things that, like, a typical neuropsychiatric disease, right, or illness is not going to have go along with it. And he's also talking about, having, like, digestive complaints and stomach pain and muscle pain and headaches and, all of these other things. And I'm like, did anyone test you for tick-borne disease? And, and I can't honestly remember if it was a yes or a no. But long story short, he had Lyme and other co-infections. And over just a few months of appropriate treatment, he was able to return to school and graduate with his class.
Amazing.
So I would say that's a huge success story.
Absolutely.
If he didn't figure out what was wrong with him, like,
who knows how long he would have been institutionalized and getting worse and sicker and not ever having an answer. So yeah, that's amazing.
Awesome. I feel, is it okay if I just say something right now?
Yeah, absolutely.
So I want everyone listening to know that, like, it is not normal to have an abrupt onset of psychosis or neuropsychiatric symptoms. So, like, it's not normal to just develop seizures. It is not normal to just develop panic attacks or insomnia or severe depression or, any of those things. Like, that is a huge red flag that it is infectious in nature. And everyone should really, especially after COVID, read about PANS, right? So we have these autoimmune psychiatric responses to different organisms, infectious organisms in our environment. And they don't respond the way that someone would respond to typical psychiatric medications, because it's not a neurotransmitter imbalance. It's massive inflammation in certain regions of the brain that are responsible for controlling things like our fears, right? Or can lead to OCD and all of these other presentations.
Absolutely. Yeah. It's interesting because Lyme, it's not like one set of symptoms, right? It's not like, oh, you got Lyme, so you have joint pain. Like, it can affect so many people in so many different ways. Like, some people get more neurological, some people get more psychological symptoms. And I feel like Lyme just kind of goes to your weakest area of your body and just takes over there and wreaks havoc. So that's why it can be so hard to diagnose as well, because no one presents exactly the same. And like you said, all of a sudden you have seizures one day, or all these, like, psycho-emotional symptoms that just showed up one day. Like, there has to be a reason that triggered on, and most likely it's an infection. People just aren't looking for that. So yeah, I'm glad you were able to help them.
Yeah. And I mean, so I always say it goes to the weak spots of your body like a magnet, right? So they can be genetic weaknesses, but they could also be previous injuries. And then people are like, oh, I tore my ACL skiing, so of course my knee hurts. No, it just swells and goes away every now and again. And it's like, well, that's not really normal. Like, if you had it repaired. And so doctors and patients like to explain symptoms away. Do you want me to tell you quick about another patient?
Yeah, I would love to.
Okay. So I had another patient come in, and she was suffering from migraines. And it was really her only complaint, but they were so debilitating that she couldn't work. And she had severe EMF sensitivity. So, like, she couldn't be around, like, a computer. She couldn't watch TV, like, none of that stuff. And she had a car accident 3 weeks 3 years prior to seeing me. And so she had a neurologist and she had an orthopedist and she had all these specialists, and everyone just blamed all of her symptoms when she finally did come out with, all of the other aches and pains. But it was like, it took 2 months for her to even tell me about them, because even she was explaining them away because she broke like almost every bone in her body in this car accident. And so again, talking with her and doing a very thorough history, she was complaining of like hot flashes and night sweats and like POTS-like symptoms. And it was like, well, were you ever tested for Lyme? And she was like, no, like no one will ever test me for anything. They just keep saying it's because I broke every bone in my body and was in a severe car accident. And so long story short, she had Lyme and co-infections, and she got to the point where she was using Botox to manage her migraines, and it wasn't even working. She got to the point where she wasn't even doing that anymore, was able to wean off everything and was symptom free.
Wow.
But, the important sort of point about this story is explaining everything away, number one. But number two, it's not like she got in the car accident and then got Lyme. She probably had Lyme.
And just all woke up with the accident.
Right, because of major trauma. So she had major physical and emotional trauma that increased cortisol, suppressed her immune system, and suppressed it to the point where the Lyme just got a foothold and kind of like took over and fed off of the massive injury and inflammation and immune dysfunction.
Yeah.
So I would argue that even, all of the symptoms that went on from her accident weren't just from her accident. It was from these dormant infections being activated. So I'd like to tell people, any major trauma in your life, whether it's emotional or physical, can affect your immune system and your inflammation to the point that it actually makes you a hospitable environment for these things to come out.
Absolutely. And I want to touch quickly on Lyme testing. So, that's a big kind of gray area. And, if you go to your regular doctor and do the LabCorp or the Request labs, it's going to miss at least 50% of Lyme cases. And then we have like some of the better labs like IGeneX and Vibrant Labs and DNA Connections. What tests do you use in your practice? Which one are you finding to be the most reliable? And what's kind of your take on what's going on with Lyme testing currently?
Sure. So I'll give you the fast forward version. So the problems with testing, number one, is that it matters when you test. So if we're talking about a new tick bite, the common scenario is you find the tick, you go to your doctor, within a couple days, they give you the test within, let's say, a week of getting bit, and then it comes back negative. So these tests are indirect. They're looking at your immune system's response to the infection through antibody production. And so there's two antibodies looked at, IgMs and IgGs. IgMs take about 3 weeks to hit the peak production that the test would actually flag and consider to be reactive. IgGs can take 4 to 6 weeks. So if you test too soon, you're going to get a false negative, but a lot of medical professionals don't know that. So even when you go on to develop like significant, like bold-faced Lyme symptoms, they're like, well, but you don't have Lyme because you were negative, right? So the timing of the test matters, number one. Number two, like you said, LabCorp and Quest are crapola. They're looking at one species of Lyme, and there's like 19 different species that need to be tested for. And, Borrelia is Lyme. What about Babesia, Bartonella, Ehrlichia, Brucella, like all of these other co-infections that are transmitted by vectors like ticks and need to be tested for as well? So to answer your question, I use IGeneX and I use Vibrant. Those are the main two labs that I use. And honestly, I leave it up to the patient. So I tell the patient, look, here's the pros, here's the cons, here's the price. You decide what you can do. In the Lyme disease world, I would say that IGeneX is definitely the industry gold standard of testing. They've been around for a very long time. They are very good at what they do. I trust them 100%.
That's how I got diagnosed with IGeneX.
Yeah.
Yeah, they're great. Awesome. And then, so in addition to your amazing practice helping so many people and becoming so knowledgeable about Lyme, you also have the Lyme Bite Symposium, and you're currently doing the Dr. Talks Lyme Summit. Can you share a little bit about what those summits are about and all the good info for people to tune in and listen into that as well?
Sure. So the Dr. Talks Healing Lyme Summit is actually ongoing as we speak. So my co-host is Dr. Richard Horowitz. I'm sure most people listening have heard of him or read his
Absolutely.
books. And between him and I, we interviewed about 50 different Lyme specialists. And it's so much amazing information, and it's done in a way that it is appropriate for the layperson, someone who's curious if they have Lyme or if they know they have Lyme or a loved one has Lyme, as well as medical practitioners. So I feel like everybody really is going to get a lot of information out of this. And, we talk about everything, from pediatric treatment and, antibiotic treatment to natural treatment, herbal treatment, adjunctive therapy. We talk about, PANS and PANDAS. We talk about mycotoxin illness, mast cell activation syndrome, all of these various things, that are kind of part of these vector-borne diseases.
They all go along with Lyme for some reason. They like to join the party, unfortunately.
Well, I always say Lyme infects every cell in the body. And so therefore it has the ability to affect every cell and therefore every organ system. And, it's just all, I look at all of these separate little diagnoses as symptoms.
Absolutely. Well, Dr. Hinchey, thank you so much. It was so great having you on today. I'm definitely going to have to share all the links to the Lyme Talks Summit, and then also to your practice as well. If people want to find you on social media, can they find you?
So I'm on Instagram at Dr. Myriah Hinchey. And also for the Lyme Bite Symposium, that's going to be in October in Mystic,
Awesome.
Connecticut in person. It's October 25th and 26th. It's a Friday,
Awesome.
Saturday. And you can go to lymebites.com. So LYMEBYTES.com. And there's also going to be a virtual platform for that as well.
Awesome. We'll link to everything on the show notes so that people can find you.
Wonderful.
Thank you so much for sharing all this great information. I really hope this helps people, whatever stage of the journey they're on, and hopefully help someone prevent getting Lyme as well.
Thank you, Erica.
Yeah, thank you so much. Thank you.